Hi. Welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the access to care and continuity of care, ACC. What is the process of admitting patient? The process of admitting a patient to the hospital involves several coordinated steps to ensure that the patient receives appropriate care based on their medical needs. Here's an overview of the typical process. 1. Initial assessment and decision to admit. Patient arrival. The process begins when a patient arrives at the hospital, either through the emergency department (ED), a direct referral from a healthcare provider, or as a scheduled admission for surgery or other treatments. Clinical evaluation. A healthcare provider, such as a physician, nurse practitioner, or physician assistant, conducts an initial clinical evaluation. This includes a review of the patient's medical history, current symptoms, vital signs, and any necessary diagnostic tests. Decision to admit. Based on the evaluation, the healthcare provider determines if the patient requires hospital admission. The decision is typically based on the severity of the patient's condition, the need for ongoing treatment, and whether the patient can be safely managed in an outpatient setting. 2. Admission orders and documentation. Admission orders. Once the decision to admit is made, the healthcare provider writes admission orders. These orders typically include the admitting diagnosis and reason for admission, the designated hospital unit or department where the patient will be admitted, e.g., ICU, general medical unit, surgery, initial treatment plan, including medications, diagnostic tests, and any special instructions, dietary restrictions, activity levels, and any necessary consultations with specialists. Patient consent. The patient, or their legal representative, provides informed consent for admission, treatment, and any necessary procedures. This includes signing any required documentation. Documentation. All relevant information is documented in the patient's medical record, including the clinical assessment, admission orders, and consent forms. In some cases, additional documentation may be required for insurance authorization. 3. Registration and insurance verification. Patient registration. The patient's information is entered into the hospital's registration system, which includes demographic details, contact information, and insurance details. This step ensures that the patient is properly registered for their hospital stay. Insurance verification. The hospital's billing or admissions department verifies the patient's insurance coverage to ensure that the admission is authorized and that the necessary documentation is in place for billing purposes. 4. Transfer to the admitting unit. Assignment of room/bed. The patient is assigned a room and bed in the appropriate unit based on their medical needs and the availability of hospital resources. Transport to unit. The patient is transported to the designated unit by hospital staff, such as transport personnel or nurses. In some cases, the patient may be transported on a stretcher or wheelchair, depending on their condition. 5. Nursing assessment and care planning. Nursing admission assessment. Upon arrival at the admitting unit, a registered nurse, RN, conducts a comprehensive nursing assessment. This includes a review of the patient's medical history, current condition, medications, allergies, and any special needs. Care plan development. Based on the nursing assessment and the physician's admission orders, a personalized care plan is developed. This plan outlines the patient's care needs, scheduled treatments, and any specific interventions required during their stay. 6. Initial treatment and monitoring. Initiation of treatment. The healthcare team begins implementing the treatment plan, which may include administering medications, starting 4 fluids, ordering diagnostic tests, and providing any necessary therapeutic interventions. Ongoing monitoring. The patient is continuously monitored by the nursing staff and other healthcare providers. Vital signs, symptoms, and responses to treatment are regularly assessed and documented. 7. Interdisciplinary team involvement. Consultations and collaboration. Depending on the patient's needs, the admitting physician may request consultations with specialists, e.g., cardiologists, surgeons, physical therapists. The interdisciplinary team collaborates to ensure comprehensive care. Patient and family communication. The healthcare team communicates regularly with the patient and their family, providing updates on the patient's condition, treatment plan, and any changes in care. 8. Documentation and communication. Medical record updates. All assessments, treatments, and changes in the patient's condition are documented in the medical record. This documentation ensures continuity of care and provides a legal record of the patient's hospital stay. Handoffs and shift changes. During shift changes or transfers between units, healthcare providers conduct handoffs to ensure that all relevant information is communicated to the next team caring for the patient. 9. Patient education and discharge planning. Education. Throughout the admission process, the patient and their family are provided with education about the patient's condition, treatment options, and any necessary follow-up care. Discharge planning. From the moment of admission, discharge planning begins. The healthcare team works with the patient and their family to plan for a safe discharge, including arranging follow-up appointments, home care, or rehabilitation services as needed. 10. Review and evaluation. Quality review. The admission process and the care provided are regularly reviewed by hospital quality improvement teams to identify areas for improvement and ensure compliance with best practices and regulatory standards. Conclusion. By following these steps, hospitals ensure that patients are admitted safely, receive appropriate care, and have a clear plan for their stay and eventual discharge. This process is critical for maintaining continuity of care and optimizing patient outcomes.